Welcome to another episode of Whisper with the Dr.صالحة. Today we have a distinguished guest, Dr. Manju Jose. She's a physiotherapist manager of Quadazone Physiotherapy Clinic. She's also a Canadian licensed physiotherapist with more than 11 years of experience. Her area of interest are musculoskeletal pain management, pelvic floor rehabilitation, and geriatric rehabilitation. Welcome to the Whisper with the Dr.صالحة, Dr. Manju.
Thank you so much, Dr. Zalia.
It's our pleasure to have you. I think today's topic is very important because we're going to discuss about back pain and myth behind it. So can you first tell me what is the back pain? What's the definition of back pain and how the proper management of back pain?
So basically, back pain, like almost all of us have experienced at least one point in our life. So it's like a movement disorder. Mm-hmm. So movement and exercise is kind of, treatment for mechanical low back pain. Mm-hmm. So we'll be seeing more in detail about this.
So it is usually a common thing is happening. It's most for the men or women suffering from back pain, according to your experience?
Depends, but in the clinic, I see almost 80% of women than men. Having back pain.
And it's kind of difficult to assess. And sometimes there's a lot of investigation being requested. And we may go advance of MRIs. Do you think that MRI is necessary for each back pain?
Basically speaking, there are specific physical tests with which we can assess the reason of back pain. So if it's mechanical, there could be some muscle strain, there could be some ligament issues, or there could be something like involvement of the dermatome or myotome, So many things can cause back pain. So the primary thing will be a proper diagnosis and assessment. And an MRI is not necessary in the very first stage of assessment, basically, because we palpate, we try to find it out. And if it's like the third or fourth stage of disc issue, then definitely we would require an MRI.
So according to the stages, stage 1 probably mild pain that doesn't require immediate.
It doesn't usually,
yes. And sometimes you get that advice from people not expertise. They're saying that you should avoid exercise and avoid certain movement. Is it true that if you have a back pain, you need to avoid exercises?
Yeah, as I told you earlier, it's basically a movement disorder. So movement and exercise is, it's a basic recovery step. But if the pain is like too severe, like in VAS scale, if we say it's like 10 on 10, then we generally don't recommend patients to have exercise done. Instead, they'll rest for a day or so with some basic isometric exercises to get onto the path, Then we start with more of exercise.
So you're rating the pain from 0 to 10 or from 1 to 10?
It's usually from 0 to 10. Right. That's the VAS scale.
Right.
So 0 to 5, it's like moderate pain where exercises can be done. Whereas above 5, up to 10, it's like severe pain. So depending on the stage, we advise proper exercise.
Is it subjective or objective in terms of?
It's the rating is of course subjective.
Right.
Yeah,
I see.
because the perception of pain is different for people.
Absolutely.
So yeah, the way they explain, we ask them the details, and that's how we come to a conclusion.
Right. Absolutely. And with the back pain, there may come a lot of other organic disorders.
Issues.
Like herniation.
Disc herniation is one among these, and it could be a weak core muscles. Basically, almost all the people have this weakness in their core. It could be a pelvic floor dysfunction as well, which can cause a radiating or referred kind of back pain. Right. So there are so many reasons contributing to back pain.
Right. So disc herniation or herniated disc, does it require surgery all the time?
Even the disc herniation, I would say, like the stage 4 one will definitely require a surgical correction. Whereas up to stage 2 and 3 can be managed by physical therapy.
Okay. So physical therapy or physiotherapy play a major role.
Definitely plays a major role in, regaining your momentum, regaining your movement, your daily activities.
Right.
Sure, yeah.
Right. And when people someone can concern about the back pain, I mean, you say there's a rating from 0 to 1 to 10. When as a person having a back pain, maybe something is worrisome or red flag to go to the surgery, for instance?
The first and foremost red flag would be a pain which is constant, non-stopping or no intermittency. It's continuous and it's always 9 or 10 on 10. That is a red flag, of course. Night pain is a red flag, of course. And I would say something called saddle anesthesia, where you'll not be feeling much of your anal area, pelvic floor.
Right.
If the sensation is less over there, then definitely you'll have to go for an MRI. Maybe you'll have to go for a surgery as well.
Right.
Because if there is any nerve involvement, we need to rule out.
Right. So the more severe, the more concern.
Of course, yes.
And sometimes we hear that from expertise like you, and we're happy to have you, that bed rest is very important for the back pain. Is it still recommended, or is it outdated nowadays?
I'm here actually to burst that myth, It's not that bed rest will give you a relief.
Right.
Basically, we have to be moving. As I told you, the initial days, a day or two, a bit of rest is fine. But recent research says even using a belt for a long time can weaken your muscles.
I see.
So weakening can again cause you more pain. So it's like a vicious cycle where you'll not get out of it unless you are correcting with some exercise.
Right.
So not like a heavy weight lifts, nothing like that. It's like a basic isometric exercise that a person should focus on.
How long can you exercise that to prevent a back pain or to treat back pain?
Yeah, treatment depending upon the chronicity of pain. Initial 2 to 3 weeks are required to feel, that good feeling should,
Right.
for that. Yeah.
Right.
Later on, you can make it like 4 to 5 days in a week. You can do it at home as well. Yeah.
How we prevent back pain beside of changing position and movement? Is there any like supplement that you can help to reduce back pain?
Preventive aspect, I would say you should focus on strengthening your core muscles. That will not cause you in a position that you are having a herniated disc. That should be the primary aim. In terms of supplement, there are so many supplements available, but I would say sticking on to drinking lots of water and having more of diet. I mean, in the sense which is having more of calcium and vitamin D. That's the basic, essential thing to prevent. Back pain
preserve
and recurrences.
the bone.
Of course,
So, what kind of a message or key point you want to send to our audience through this podcast?
Yes. So what I would like to say is always be hydrated. Because if you're drinking less water, again, this causes muscle stiffness and, things like that. Number 2, I would say you should keep changing your postures every 20 to 30 minutes.
Right.
It's difficult for everybody, but at least, if you're sitting for a long time, in a half an hour, you can just get up for a minute and sit, So keep changing every now and then, which is a, inevitable thing.
One day I heard read a research is saying that every 30 minutes you should move. Is it true?
That's true, yeah. So it's like 30 minutes you change your position so that your muscles are getting a bit of rest, That's how we try to, alleviate pain so that the pain doesn't come back often.